Welcome back to Unapologetic Black Minds, where we advocate for the mental health of teens in the Black community. My name is Deja, and if you didn't listen to the last episode, we discussed anxiety, more specifically, generalized anxiety disorder. Today, the topic is depression. Depression is a mood disorder that, according to the American Psychiatric Association, negatively affects your feelings, thoughts, and actions. It is commonly associated with overwhelming feeling of sadness or feeling down. Of depressive disorders such as persistent depressive disorder and perinatal depression. However, for this episode, we will be talking about major depression. Major depression is identified as being in a depressed state / having feelings of sadness or developing a lack of interest in things and activities that were once enjoyable. The DSM-5 have two criteria for diagnosing major depression. 1. 5 or more of the following symptoms occurring together and representing a change from previous functioning within a 2-week span. Depressed mood most of the day, nearly every day, as indicated by either subjective report or observations made by others. Markedly diminished interest or pleasure in most activities, most of the day, nearly every day. Significant weight loss or weight gain. Insomnia or hypersomnia, so not being able to sleep or sleeping longer than usual. Psychomotor agitation, or the repetitive, unintentional movements that happen while being restless. Fatigue or loss of energy. Feelings of worthlessness or excessive guilt. Diminished ability to think or concentrate or indecisiveness. Reoccurring thoughts of death, suicidal ideation, or a suicide attempt or plan. At least one of the symptoms has to be either depressed mood or loss of interest or pleasure. The second criteria is symptoms cause clinically significant distress or impairment in social or other important areas of functioning. Teens can also experience irritability and are more likely to show signs of feeling hopeless, turn to substance abuse, isolate themselves, have suicidal thoughts, and increased propensity for suicidality or risk of suicide. Treatment for major depression can include antidepressant medication and various types of psychotherapy such as talk therapy, CBT, and interpersonal therapy, which helps improve relationships with others and focuses on the social aspect. You can help your teen struggling with depression by being involved in the care of your child, knowing who is caring for them and what is happening. Also, being vigilant to worsening symptoms and signs of suicidal ideation is important. You should have an emergency plan, especially if you know your teen is having suicidal thoughts. Being present is key, and it is important to remember that just because they're teens doesn't mean that they don't experience mental health issues as well. Remember, getting a diagnosis and treatment isn't a bad thing and will surely make their lives better in the long run. Thank you for listening.